It's the Painexam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the Painexam newsletter at painexam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the Painexam app with a premium subscription or access for free with a CME subscription at painexam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back. We have a lot of great things going on. We just redid the nrappain.org website, and we have Painexam Complete added to it under the flag of the Virtual Pain Fellowship, in which I just added a TMJ and maxillary oral facial pain lecture based on an ultrasound course I recently did to identify the TMJ as well as some cranial nerves. And I added the regional anesthesia course on demand. I've been going back to the OR doing a lot of regional anesthesia, as well as the course for emergency medicine physicians who are looking to integrate regional anesthesia blocks in their emergency room care for patients. And just quick announcements, I am running the West Virginia SIP ultrasound course. So if you're going to the Appalachian Spine and Pain Society's West Virginia SIP meeting, be sure to sign up for the ultrasound course. It's going to be a 2-hour focused course on PNS, regenerative medicine, and ablative targets for pain docs. And I must say lately I've been having a lot of success with the ultrasound guided ablative procedures. I've been doing the geniculars forever, but I'm recently starting to do the hips, and it's really working out well, especially with the cryoablations. So before I forget, as you probably know, I do monthly ultrasound courses, and I have one coming up in Miami, New York, West Virginia, as I mentioned earlier, and we're doing a regenerative medicine course May 4th in New York City. It was a lot of fun last time. We spun out some PRP, and I think you'll find it useful for your practice. In fact, I have 3 spine PRP injections today, and my regenerative medicine practice has grown significantly over the last year, actually exponentially over the last year, and there's a few reasons for that, and we could discuss that at the course. Anyway, if you are studying for the pain boards, your best bet is the Virtual Pain Fellowship, which is actually more affordable now because you could just subscribe by the month as opposed to buying the full year, which is basically the Painexam Complete, which includes everything I mentioned, plus bonus missed keyword lecture series, a lecture I did with ASIP a couple years back, but still relevant, and ultrasound training online. So anyway, this is a article which you'll have in the show notes that was sent to me by Robert Stahl, who's a pain physician who I taught with over the summer, and it kind of is making me think of why my peripheral interventions are working on central pathology, meaning if you've listened to the podcast before, and I've mentioned it many, many times, so forgive me if I sound like a broken record, you can treat a central problem such as a herniated disc, the pain related to that, with a peripheral shot, meaning patient has L5-S1 disc herniation, they're on Plavix, you can't do an epidural, you do a sciatic nerve block under ultrasound, and they can get better. I've seen it in the neck. I don't like doing cervical epidurals unless I have to, and I do ultrasound-guided selective nerve root blocks or suprascapular nerve blocks. And by the way, this was discovered by accident when I didn't have a C-arm for about 6 months of my career, about 12, 13 years ago when I was transitioning from anesthesia to pain. And I discovered you don't need to do an epidural to treat a central problem like a disc herniation. And this may give us some insight as to why these peripheral injections are helping central problems. And the title of the article is Ventricular Infusion and Nanoprobes Identify Cerebrospinal Fluid and Glymphatic, not lymphatic, glymphatic with a G, circulation in human nerves. So I'm going to just briefly summarize this. You can look up on your own, But basically, there's growing evidence suggesting that CSF circulates in human nerves. And if you're younger, maybe they're teaching this in med school, but they were not teaching this 25 years ago when I was in med school. Several conditions encountered by plastic surgeon may be related to dysregulation of the system, including nerve, transection, stretching injuries, and peripheral neuropathy. The purpose of the study is to show how ventricular infusion and nanoprobes identify CSF and glymphatic circulation in neural sheaths of humans. By the way, doctors are performing dextrose injections related to on peripheral nerves, and they're treating, and that's another topic which I'm not going to get into much today, but that could also treat pain, and that's related to this. So they did. They looked at 8 cadavers who underwent ventricular infusion. 6 were female, 2 were male. 46 to 97. Ventricular cannulas were performed successfully using coordinates 2 centimeters to the coronal, anterior to the coronal suture, and 2.5 centimeters lateral to the sagittal suture. And they did a ventricular saline infusion complemented by nanoprobe injections, suggesting CSF flows in neural sheaths, including pia meninges, epineural channels, perineural sheaths, and myelin sheaths, the neurolemma. They concluded that ventricular infusion and nanoprobes identify CSF flow in neural sheaths of human cells. CSF flow in nerves is an open circulatory system that occurs via channels, intracellular flow, and cell-to-cell transport associated with glial cells or glial cells. Neural sheaths, including neurolemma, may participate in glucose and solute transport to axons. The technique may be used in an anatomical dissection and live animal models, and it's been extended to the CNS to identify direct ventricle to pia meninges CSF pathway. So they found that ventricular saline infusion, complemented by the nanoprobes having a diameter of less than 10 nanometers, identified CSF flow in the pia meninges, epineurium, perineurium, and myelin sheaths of nerves. CSF circulation in nerves is open circulatory medium for transport of energy and solutes. So therefore, dysregulation of this CSF circulation in nerves may play a role in clinical problems facing, they're talking about plastic surgeons, nerve transection, stretch injuries, and peripheral neuropathy. Forget about the plastic surgeons. What about the pain docs, right? This is huge. So they go on to say that the neural sheaths and meninges express a wide range of solute-carrying proteins, SLCs, involved in active transport of glucose, lactose, pyruvate, and ketones. Probes with a diameter closest to that of glucose, 1.5 nanometer, were chosen, and the examples were presented in this article to show how the techniques may benefit future research in this field. So I think the implications here are huge. Here they have a figure where they show proximal median nerve identified in a 50-year-old male specimen. Before the injection, you see flat, indistinct epineural channels in the picture, and then after injection of the nanomolecular fluorescent quantum dots, you see the channels are distended and is fluorescent. So the drainage to adjacent subcutaneous lymphatic vessels is noted, and microsurgical dissection noted fluorescence of the perineurium, endoneurium, and myelin sheaths. Now, interestingly, here they're really mentioning that the flow is a system mainly from the ventricles or from the CSF of the CNS all the way down to the nerves. I'm thinking with my treatments, there's also the traveling back towards the CNS for recirculation. And so here they're just mentioning CSF travels in the neural sheath, can drain to the peripheral lymphatic vessels, and may recirculate directly to the thoracic duct. Well, I'm still looking for the exact explanation as to why a peripheral shot helps centrally. Of course, there's the systemic effect of steroids, but still, it's more than that. So I don't think this article is the end-all, be-all, but I do think it's relevant to what we're doing, and it's something that is either unknown or underappreciated in most academic texts. I don't really hear much about this. Perhaps you do, but I don't. So connection between the CNS and the peripheral nerves via some transport system, aside from the action potentials, is quite interesting and relevant to our practice, I'm sure, in some respect. So anyway, thanks for listening. Please recommend the podcast to any of your colleagues. And if you can give a review on iTunes or one of your podcast players, that'd be great. Or share the episodes. I'm always looking for volunteers to help me grow my platform. What I do need is people to help me create new content and get their name out there. So you'll be helping yourself while you help the Pain Exam and Rap Academy platform. And you don't need to necessarily be a pain doctor to do this, because there's a lot of overlap. Most doctors do treat pain on some level, and there's probably something that we could find for anyone who's looking to contribute as well as gain some recognition. Thanks for listening. Appreciate you guys tuning in, and I will hopefully see you at the conferences or my ultrasound or regenerative medicine courses.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.